host of the Journey to Motherhood YouTube channel. Today we have a special guest in our channel, Dr. Stephanie Liu. In this video, she shares her medical advice and tips on trying to conceive. Dr. Liu joined us in our Facebook group community for a live Q&A, and it was so insightful. To join in on the conversation next time we have a guest in the Facebook group, join our group with the links in the description. I hope you enjoy the conversation.
Okay, hi everyone. I'm Dr. Stephanie Liu. I'm a family physician, mom of two, Maddie, who's 4 years old, and George, who's 15 months, and also the founder of Life of Dr. Mom, a parenting vlog where I talk about my experiences as a mom and also provide evidence-based, so medically credible information about mom health, baby health, child wellness, and parenting. And I'm so excited to be here with you guys today. And I really appreciate you guys taking time out of your busy schedules to come hang out with me and talk about some of my experiences as being a mom and ways in which we can prepare ourselves for pregnancy. So I'll just start off with some questions I had about fertility. And at the end, I think that you guys will be able to send messages to me and I'll answer as many questions as I can get through from that too. So these are some questions about fertility. The first question I got was a really good one. What is the best way to track your ovulation and fertility? Okay, so there's a few different ways. If you go to your doctor, one of the first tests that they'll do to make sure that you're ovulating is a hormone test where they look at the hormone progesterone. And normally this test is done on day 21 of your menstrual cycle. If you have a 28-day cycle, it may change if you have a longer or shorter cycle. And what they do is they check that hormone level on that certain day, and what that hormone level will tell us is whether or not you're ovulating. Another way to check ovulation and to get a better understanding of when you're ovulating is those apps where you can look to see which days of your menstrual cycle you're more likely ovulating. This is actually the method that I used to track my cycles, and I really like it because it's pretty easy. All you have to do is put in when you had your period for those periods of days, and then put in when your next period is, when you're experiencing your period. And the best part about this is the more data that it collects, the more accurate it will be. It'll get a better understanding of your cycles. Another method to track ovulation is something called ovulation predictor kits. So those are the sticks that you get and you pee on them, and it detects hormone levels. And when a hormone level reaches a certain point in your urine, that's when ovulation is more likely to occur. So those are what people, I think, sometimes call them the ovulation pee sticks. The other way is something called natural family planning. So what this technique is there's kind of two main techniques. One is checking temperature and one is checking cervical mucus. So you get a thermometer. We recommend an accurate temperature where you can get, with decimal points. And the way our body, the way we'll figure out whether or not you're ovulating when you are is temperature changes before and right after ovulation. So based on these temperature changes, someone can figure out when they're ovulating. Another thing is with checking your own cervical mucus. Our cervical mucus changes throughout our menstrual cycle. Sometimes we have less, sometimes we have more, and the texture can also suggest when we're more likely ovulating. One of the best descriptions I heard of when someone's ovulating is your cervical mucus should feel like raw egg whites, right? And I think most of us kind of know what that feels like. Okay, the next question I have is another good one. How can men improve their fertility? So one thing that we recommend right off the bat is if you're smoking, to quit smoking. Quitting smoking is super hard. Unfortunately, my dad still smokes, and I know I've seen what a struggle it is to quit smoking. I know how hard that is, but really that's one of the best ways to help improve fertility. Another thing where it shows improvement in likelihood of getting improving fertility is if you're overweight or obese, weight reduction to an appropriate weight has also been shown to help with fertility. In general, we also recommend when you're trying for pregnancy to eat a well-balanced diet. So less processed foods, more fruits, vegetables. If you eat grains, whole grains. Okay, another great question. So what supplements should you be taking? So when you're trying for pregnancy, I recommend taking folic acid, iron, vitamin D, and vitamin B12. There are some other things added into supplements that can be beneficial, but really I call these my main four. So if you're looking at your prenatal, please make sure that you have these in them. Okay, another awesome question. How long should you take a prenatal vitamin? Is there such a thing as too soon? Okay, so in prenatal vitamins, there's one vitamin that is very, very, very important. I would say one of the most important vitamins if you are trying to get pregnant, and that's folic acid. So folic acid is really important because it prevents something called neural tube defects. So our neural tubes on the back of babies is their little neck area. And folic acid, you need to have adequate amounts of it for the baby's little neck area to grow properly. So this is one of the most important vitamins that you should be taking if you were trying to get pregnant. We normally recommend 400 micrograms, so it should say 400 mcg, but some people are at higher risk of these spine problems called neural tube defects for their babies, and we recommend an even higher dose of 5 milligrams. So what we recommend is at least 3 months before becoming pregnant. Some people even say that everyone of childbearing years should actually just be on a folic acid supplement. Personally, I started right away when we were even thinking about having kids, even before that. So I was on prenatals for I think a year before we conceived our daughter Maddie. Okay, you guys are coming up with the best questions. I'm just gonna actually close this. Sorry, my other computer I was getting emails from that one. So the other question I have is, can Mucinex really help you get pregnant? Okay, so Mucinex is actually it's a cough and cold medicine that helps with coughs, and it's been talked about a lot on social media recently. And the thought is that if you take Mucinex, the active ingredient, the generic name of Mucinex is called guaifenesin. Some people have experienced getting pregnant while taking this medication. Based on the literature that I've read and the information that's available right now, there really isn't enough information to say that Mucinex, or also known as guaifenesin, increases someone's risk of being pregnant. So right now, long story short, there's not enough evidence to really say whether or not Mucinex will help you get pregnant. Okay, awesome. Another great question. How long does it typically take for your period to go back to normal naturally after getting off depot shot? Okay, so the depot shot, I don't know why I called it depot, but the depot shot, also known as Depo-Provera, is a shot that you get injected into, often most likely into your arm, and you get it every 3 months. And this is a way to prevent pregnancy. And so what I recommend is if you're thinking about getting pregnant in the near future, don't go on Depo. And the reason is that sometimes it can take up to 10 months for someone to ovulate regularly after being on Depo. So what that means is some women won't even get their periods for at least 10 months. So if you're thinking about getting pregnant in the near future, Depo is I would not recommend that as a form of birth control. Okay, how soon after getting off birth control should you start trying to have a baby? Okay, really great question. So what healthcare professionals, including myself, what we typically recommend is to wait to get your first period before you start trying. And the reason that is it makes it a little bit easier for us to figure out dating. So for example, if we know when your last period is, we'll get a better idea of when we should be ordering ultrasounds for dating. But that being said, I don't know if this is too much information, but for our second child, I didn't listen to my own advice, and I actually ended up getting pregnant before I had my first period, and our physician was still able to sort it out. So if you get pregnant before you have your first period after birth control, that's okay too. But ideally, we should be waiting until you get your first period before you start trying. Okay. So another awesome question. What are other ways you can tell if you are pregnant naturally? What are some signs to look for? What are body changes? Okay, so these are probably the five most common symptoms that someone may experience. There's many other symptoms, but these are probably the most five common that I see in my practice. So one is someone will stop getting their period, nausea, vomiting, breast tenderness, Another symptom that actually I experienced quite a bit was urinary frequency. You feel like you need to pee all the time. And another really common one is fatigue. You just feel exhausted and just wiped out whether or not you're getting enough sleep. Okay, our next question is a good one too. What is the most accurate way to see if you're pregnant? Okay, so urine tests to detect pregnancy are actually pretty good, but the most accurate test is something called a serum HCG. And that's just a blood test where we look for HCG, which is the hormone of pregnancy. So yes, that the blood test is probably the most accurate, but you can still diagnose pregnancy with the P test. Okay, so our next questions are about general health. Okay. So first up, okay, and this is a very good question. How to manage stress and anxiety when you've been trying to conceive for a long time unsuccessfully. You know, trying for pregnancy can be really emotionally draining and really tough. With the first time that my husband and I tried, and we were very fortunate, we were able to conceive our daughter Maddie. I remember feeling really stressed out, and I think that we tried for maybe 7 or 8 months, and then we were fortunate enough to get pregnant. But I remember feeling like every single month when I got my period, I would feel so upset and just so demoralized. And it gave me a glimpse into what people that are struggling with infertility with after a few years must be experiencing. And I can't even say that I understand it fully, but I got a small glimpse of it. And I know how upsetting and how stressful it can be, not only for the person, but for the couple as a whole. So what we recommend as physicians is, if you're struggling, consider counseling, individual or even couples counseling, to kind of talk through what you're experiencing emotionally. Group support, I think, is helpful. And I've had some patients that said that this really helped them, because it's nice being able to talk to people that are going through what you're going through. Another technique that we've discussed that I think is beneficial is something called mindfulness. It's, focusing on the here and now. And that's been helpful for some of my patients that have been struggling with fertility. Relaxation techniques, stress management, or other things that will probably be discussed with you too if you're struggling. In general, I also say, finding activities outside of thinking about pregnancy is also a really good thing. So if you enjoy exercising, making sure that you're able to carve time out to exercise. If you like knitting, start trying to knit. Look for activities that kind of give you a break from thinking about this trying for pregnancy journey. Some people have even taken a break from trying for a month or two to just see how if that helps with stress reduction too. For some people, even if they're doing all the right things, going for counseling, attending support groups, trying mindfulness practice, sometimes people may need medications to help deal with some of the mood changes when trying with pregnancy. This is a really, it's really hard, and now I'm kind of rambling because it's really challenging if you are struggling with infertility, and I really encourage you to reach out to your family doctor, your OBGYN, or whatever other healthcare professionals you're seeing if you are struggling. Next question is, what does it mean when you miss a period but get a negative pregnancy test? Okay, good question. So it may mean it's just too early to detect a pregnancy, because especially with the P test, you have to reach a certain amount of hormone levels before you're able, before the P test is able to detect pregnancy. The other possibility is maybe you didn't ovulate that month, and that's why you didn't get a period. Okay, you guys are coming up with awesome questions. Okay, another one is, how often should you see a doctor when you're pregnant? Okay, so once you find out you're pregnant, I always recommend going in for that initial assessment. So that when you go in for that initial assessment, your doctor may give you an ultrasound test to determine how far along you are in your pregnancy, and some lab work to check for your blood type, and also to rule out any infections, and just to check your thyroid levels. For uncomplicated pregnancy, so these are average risk pregnancies, we recommend seeing your doctor every 4 weeks until 28 weeks. and then every 2 weeks from 28 to 36 weeks, and then weekly until delivery. COVID has been a strange time, and often some of your in-person prenatal visits might get changed to virtual appointments. But I still encourage you guys to, if you are pregnant, to still go in intermittently for in-person visits. And the reason is we need to be able to check your blood pressure. Blood pressure during pregnancy is important to be assessed for too. Okay, very good question. What kind of questions can you ask to make sure you find the right OBGYN for you? I think the way I think about finding the right doctor, it's almost like a blind date. Like, you don't really know if you like the doctor until you meet them in person. But there are things you can do to try to find a doctor where there's a higher likelihood of you guys getting along, and where there's that great communication, where you feel like you can speak to your doctor about anything. So what I recommend is talk to your friends. Friends often have similar personalities with each other and often like the same people. So what I recommend is talking to your friends. Ask them, who do you recommend as an OBGYN? Who do you think is really easy to communicate with? Another thing that I sometimes recommend is looking at reviews online. However, I do caution you, because sometimes the reviews online are not accurate. I know some excellent physicians that have very bad reviews, and I know some mean physicians that have good reviews. So really, sometimes reviews are helpful, but sometimes they're not. For me, one of the most important things was location. I don't like driving far distances, and I knew that I would have to go for a lot of visits to my doctor, so I chose a physician that was physically close to where I live. And I also think that, when you meet your doctor, it's okay if you don't feel that connection. Like, it's not, you meet them and you're bound to each other for this pregnancy. I do recommend, choosing someone and sticking with them throughout the pregnancy. But let's say you meet them this first time and you said, I just don't feel that connection. I think it's okay to look for another physician where you feel that there's that therapeutic relationship. Also, you can always talk to your doctor about what you have in mind for your pregnancy and what your birth wishes are too, to make sure that you guys align. Okay, another very good question. What kind of medical testing is recommended if you're having difficulty conceiving? So I think of these kind of as 5 steps. So the first thing that I check for my patients is, one, is this person ovulating? So what I normally do is I order hormonal testing to make sure that this individual is ovulating. The next thing is the anatomy okay? So what that means is the uterus appropriately shaped? Are the tubes something called fallopian tubes? Are those open? And so there's a test called it's kind of a mouthful, but it's called a hysterosalpingogram. I just call it HSG. And what that is essentially shooting dye into the uterus and through those tubes to make sure that everything is open and appropriately shaped. The next thing is it's always important to check both partners. So for the male partner, making sure semen analysis is done. And in general, for females, we only have a certain amount of eggs in our lifetime. So sometimes if we're concerned that there's not enough of an egg reserve, we sometimes do hormonal testing to see how many eggs are still available. And in general, I just do blood work to check for other things, making sure that the patient doesn't have diabetes, making sure the thyroid levels are normal, ruling out other infections that could be making it more difficult to get pregnant. Okay, you guys are kind of really good questions. What to do when your doctor doesn't seem to take your concerns seriously? So this is a tough one because, for my patients, I really want us to have, a good relationship. Sometimes I may not think a concern is as serious as a patient, and sometimes I might think a concern is more serious than the patient does. And that's why I think it's good to find a doctor that you can communicate directly with. If you feel like your doctor isn't listening to you and not taking your concerns seriously, I think it's really good to be able to just talk to your doctor and say, hey, in a very direct way, but nicely, just say, I sometimes feel, or I feel like you're not taking my concerns seriously. And I think that that's a really good way of opening up lines of communication. I had a patient that I've known for a few years, and after like a year or two of me being her doctor, she said to me, Dr. Liu, you talk way too fast. It's really hard to understand you. And you know what? I think back and I actually realized I do talk too fast. And this was all unintentional. I try not to talk turbo, but sometimes when I'm excited, I do. And it makes it really hard for people to understand me. And after she expressed this to me, when I see her, I make the conscious effort to kind of talk a little bit slower and really make sure that I pronunciate my words properly, which is actually a very important life skill for me to have.